To the news now, Vision for Alternative Development has entreated the Ministry of Health and Food and Drugs Authority to outlaw the use of what is called shisha in the country. The group argued that, that regulating the use of shisha in the country is not enough to prevent its use. Hence, the call for an outright ban, according to a survey which was carried out by the committee. Tobacco use causes 8 million deaths worldwide and 600,000 deaths from the secondhand smoke. It, however, identified some key strategies, tactics, and activities undertaken by the tobacco industry aimed at delay, divert attention, and stop the passage of acts, especially during the passage and implementation of Excise Duty Amendment Act. Now, they also called on the government to investigate what's led to the closure of the renal center. We've been joined via Zoom by the Executive Director of Vision for Alternative Development, Labram Musah, for more on this. Good afternoon, sir. You're welcome to Newsbeat. So, is there any way shisha is beneficial to the body to start with?
Thank you very much for having me, and greetings to your cherished viewers. Let me say that tobacco smoking, as well as shisha or cigarettes, snuff, if it has no benefit whatsoever to human body, what it does is to destroy humans and then also cause a lot of, disabilities and death. That is why we call it the most preventable cause of death in the world today. Killing 8 million people annually. And of course, people who don't also smoke, like me and you, when we are in a mix of people who smoke, we are likely to be affected by their smoke. That's why the world over, World Health Organization puts the number of deaths from smoking, someone else smoke, to 600,000 people who also die annually from the use of, cigarettes or shisha or so.
Yeah. So the outcome was based on smoke in general, not necessarily shisha. But why are we scaling down on shisha?
Right. So, in fact, shisha is one of the new and emerging, trends of cigarettes. But the industry are very smart and they want to continue in business. So every now and then they come out with new strategies, new ideas, new approaches, new tactics on how they can, attract, especially the youth. Because if you look at how the shisha look like, it looks very attractive. It looks very glamorizing. So that's the point. And because it's a new product, that is coming up, the industry is putting measures to ensure they're able to hook our young ones, our children, into the use of this product. And research have shown us that smoking shisha or a session of shisha is tantamount to smoking about 100 to 200 sticks of cigarettes. It tells you the devastating effects that shisha would have on us as humans if we don't do anything to curtail it. That's why many countries, especially in Africa, have banned, the use of shisha in their country. We've also been calling on our Ministry of Health, our legislatures, the MPs, to as much as we can, we should come up with law to ban shisha in the country because it doesn't have any benefits. Rather, it's going to have a very serious epidemic.
So there's another one I just found out this weekend. It's called balloons. I think it's also, taking just like they do with shisha, but those ones are balloons with the chemicals in it, and you are supposed to inhale. It gets you high at some point, for some few minutes, and then you go off. Is this something that you can also consider as part of the all these things that we're taking in to do something to the body? I don't know what we benefit from it, but is that something that you know about? What will you do about that as well?
Well, I didn't get the description right in terms of what you were referring to. If you can repeat the question, sorry.
Okay, so it's called balloons. As you know, when you go to the pubs and certain areas, they smoke the shisha. But this one is called balloons, and it's made in a balloon form of balloons, with it filled with air. It's like air, but it's chemical, and you're supposed to inhale them, just like we smoke. That you inhale something. So I think it performs just like shisha does. But I hear its impact is even higher and more dangerous than shisha. Are you aware of that?
Right. So, so like I told you, these are all, new and emerging products, and obviously, if you look at the range of people who smoke these ones or who use them, they are definitely the youth. So the point for us is anything that you would consume into your system that would give you, some level of artificial, hype or artificial, glamorizing, it's definitely not the best for human body. Like I said, this thing affects our lungs, affects our kidneys, affects our respiratory conditions. So if you are consuming something that eventually will go into your system and then destroy you, especially when research have shown that it has no benefit, I think it's important that the youth restrict themselves from it. As we can see, the renal close down, for instance, basically it's as a result of, these products, tobacco, right, alcohol, shisha, smoke. So the point was if government come out with laws, or ban certain products, it goes a long way to protect, the citizenry, especially our youth and children who are our future generation.
Right.
Officially.
Right. Right. Musah, Labram, thank you. I'm just told that the balloon I'm describing, the content in it is nitro oxide. I'm not sure if that's correct, but we'll have to check. Nitrite oxide. Okay. So maybe your organization that's Vision for Alternative Development may want to check on that as well.
Definitely.